In this video, we discuss the way to gain the most information from a biopsy. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. When most people have a solid tumor, a biopsy will be done to confirm the cancer type. Then, the tissue is never put to any further use. If you're lucky, the average hospital might test for a specific gene to see if your cancer has a FDA-approved targeted therapy. But much more information can be garnered from the typical biopsy. There are companies that will sequence your tumor for you or even your hematological malignancy. Some prominent companies are Caris, Foundation Medicine, Molecular Health, Paradigm, and Concert Genetics. These tests are covered by most insurance, Medicare, and Medicaid. If by some chance you have to pay out of pocket, the going rate for genetic sequencing is anywhere from $1,500 to $2,500. In addition to informing you about any valuable genetic mutations, these tests can also refer you to drugs and/or clinical trials that may be useful to you. Just to clarify, these are genetic mutations that may not normally be associated with your cancer. For instance, you may have PTEN loss, which is widespread across cancers, not specific to one. PTEN normally inhibits mTOR and PI3K, two key pathways in cancer. So, Foundation Medicine may recommend everolimus, an mTOR inhibitor. Under normal circumstances, this medication never would have even been on the table in a discussion with an oncologist. A sequencing test should also tell your circulating tumor DNA levels and your tumor mutational burden. The higher your tumor mutational burden, the more likely immune checkpoint inhibitors like Keytruda and Opdivo will be of benefit. Even if you already have had a biopsy, your tissue sample is typically stored for many years. They can take a slice and send it for sequencing long after it was first taken. If by some chance a tissue sample from a solid tumor is not an option, Foundation One, etc., also offer liquid biopsies, where cancer cells circulating in the blood are analyzed rather than a tissue sample. An additional test you can have performed is a chemosensitivity assay. This is where mice are given tumors from your actual cancer cells. Then, different chemotherapy agents are tested against them. Private laboratories that provide chemosensitivity testing in the US include the Nagorny Cancer Institute, Wiesenthal Cancer Group, and Helomics. In Germany, there is Biofocus. In Australia, Genostics. And in the UK, Research Genetic Cancer Centre. If an entire tumor was excised during a biopsy, tumor-infiltrating lymphocytes, TILs, may be an option. Tumor-infiltrating lymphocytes are a promising therapeutic that have demonstrated efficacy in human trials for over 30 years. Yet for some reason, it is still not part of the standard of care in any country. Once the tumor is resected, the lymphocytes, a type of white blood cell that have infiltrated the tumor, are identified, replicated, then reintroduced into the patient in greater numbers. This process is offered commercially at Sheba Hospital in Israel and is available in clinical trials in many countries. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.